When Dickinson, North Dakota was experiencing an influx of workers and families due to the oil boom, Dr. Thomas Arnold, an OBGYN with CHI St. Alexius Health, noticed that many of his prenatal patients had no extended family nearby to help support them before or after their pregnancies. Arnold heard about a successful program for prenatal patients called CenteringPregnancy, and he felt this model would be a good fit for families from outside of the area.
Centering for Pregnancy program is extremely important to patients because it provides them an opportunity to be more proactive in their health care. I think it gives them an opportunity to have a more community feel with their pregnancy, and it allows them to interact with other moms who are going through a similar situation, and they can share some of their experiences.
A lot of them say they probably wouldn't have talked about these things if it wasn't brought up in the group, so the knowledge is expanding of everything, even for experienced moms.
CenteringPregnancy programs have been operating mostly in urban areas on the east and west coasts for nearly 30 years. However, the program is relatively new in North Dakota. The CHI St. Alexius Health Dickinson CenteringPregnancy program has only been around since 2017, and it is the only accredited site in the state. The program brings healthcare and education to rural areas where women often have to travel long distances to get prenatal care. The CenteringPregnancy program helps expectant mothers build a support network with other expecting families through education and discussion in a group setting.
Centering program is an excellent program. It allows patients to meet with people who have a similar situation, either their first pregnancy or multiple pregnancies.
I think just building that community when they didn't have it before and sharing those life stepping stones, I think those are the things that we can't make happen that are just happening.
Along with the social benefits of being involved with the CenteringPregnancy program, participants have measurable decreases in preterm labor rates, decreases in the number of unnecessary emergency room visits, and decreases in gestational diabetes rates. In addition, participating mothers are less likely to experience postpartum depression and are more likely to breastfeed their babies, which reduces illness in infants and reduces the costs to the patients and the rural healthcare system.
We feel the 3 E's of engagement, education, and empowerment are very important in the centering program. And we as providers tend to enjoy it because it is a fun way of providing care. We get to know our prenatal patients much better in the centering program because we're spending so much more time with them. They get to know us better, and just all the way around it makes for an improved way of presenting prenatal care.
CenteringPregnancy combines health assessment, learning opportunities, and peer support. It is an evidence-based practice that offers standardized patient-centered care for everyone, regardless of social or economic status. Providers and participants say the social bonds made through the CenteringPregnancy program experience are life-changing.
And Haylee is still friends with one of the other girls that were in the group.
We started as strangers and we became a family. That was the greatest thing I took away from it.